What is up, everyone? Welcome back to the channel. For those of you who don't know me, my name is Jordan and I'm a first year medical student in the state of New Jersey. So we are halfway through our cardiology block, which is only 4 weeks long. It's pretty crazy, the pace at which we're learning everything. The first week wasn't too bad. There's a lot of basics: anatomy, physiology, electrophysiology, a lot of stuff that I remember from like my undergrad physiology classes. But last week was a lot harder. We did EKGs, talked about coronary artery disease, heart attacks, so a lot of really important stuff, but it's been a struggle learning it at this pace. So like I said, we're halfway through, we're 2 weeks in, we have 2 weeks left, and then we have our exam. Then after that, we're gonna have 3 weeks of pulmonology and 3 weeks of renal, and then we'll have an exam on those 2 topics. One super exciting thing that is happening this week is we get our schedules for our clinical rotations. So my school is a little bit accelerated. We really have like 1.5 years of preclinical. So I'm still technically a first year, but we start our clinical rotations this November. It's currently April. I have no idea what other schools do, but my school does a lottery. It's kind of the most fair way to do the scheduling of the rotations. Typically during your 3rd year, everyone has to take the same core rotations, which are usually family medicine, internal medicine, surgery, psych, neuro, OBGYN, and pediatrics. Emergency medicine, I think, is another core rotation, but my school does it a little weird. We have it longitudinally instead of like a block, so we have to do 2 ER shifts per rotation. So we'll do 2 during our surgery rotation, 2 during our family medicine, and then we do the shelf exam at the end. So maybe a week or 10 days ago, we submitted our rank list for the different sequences of our rotations. Medical students pay a lot of attention to the order of the rotation because rotations are really the most important part of medical school. You know, a lot of schools go pass-fail now for their preclinical curriculum. So once clinical rotations start, that's when you're actually going to be getting like grades. It's not A, B, C, D, E, whatever, but usually it is structured as honors, high pass, pass, and fail. And residency programs actually see those grades and they pay attention to them a lot more than the preclinical. That's another reason that schools have gone pass-fail for the preclinical curriculum is residency programs don't really care how you did in biochemistry or histology. They more care how you actually operate in a hospital, talk to patients, interact with the team, which is what happens during your clinical rotations. So since it's such like an important, stressful thing, people kind of freak out about the order in which they do their rotations. The general advice is to do what you think you're interested in somewhere in the middle, so you have like some footing, you know what's going on, but you're not like dead tired by the end of the rotations. So for me, I'm interested in surgery, so I try to set up the surgery rotation sort of towards the middle of my rotations. At my school, we do 8-week rotations for family, internal, and surgery, and then 6-week rotations for pediatrics, OBGYN, neuro, and psych. And you sort of have to do all of the 8 weeks and then all the 6 weeks, or vice versa. So I wanted to do the 8 weeks first because I wanted to have surgery either 2nd or 3rd. I didn't want to do it first just because I would have no idea what's going on. I don't even know what a clinical rotation is. I don't know where anything is in the hospital, so definitely didn't want to do it first. But I think once I did like an 8-week rotation of internal medicine, I would have some solid footing and be able to perform well in the surgery rotation. So we'll see. I mean, it comes out tomorrow, so I'll definitely check in and let you guys know my rotation schedule. Alright, what's up everyone? It is Tuesday and I just got my rotation schedule. So first I'll talk a little bit about how I set up my rankings and sort of what I was thinking about. So my ideal schedule would have been to do family medicine, internal medicine, surgery, neuro, psych, OB-GYN, and peds. So the big thing in that scheduling is really the first 3, the family medicine, internal medicine, surgery. So I wanted to do family medicine first to sort of just get my feet wet. Family medicine is usually like a more relaxed rotation compared to some others, so I thought it would be a really good one to start on. Would have done 8 weeks of that, would have had inpatient and outpatient, so a good mix of everything. Then once I was a little more comfortable, would have done internal medicine, which is sort of a rougher one. You learn a lot, you work a lot, you just have to know so much. I mean, internal medicine is the basis of most specialties, so you have to know a little bit about so many different topics. And then after that, I wanted to do surgery because it is very similar to internal medicine. The shelf exams are apparently very similar, similar workload. And, you know, as a third-year medical student, you're not really expected to have surgical skills. It's more just about your knowledge and your work ethic and forming a differential diagnosis and putting together a plan. And the internal medicine rotation apparently prepares you to do that for the surgery rotation. So at the very least, I wanted to have internal before surgery. And then with the other 4 rotations, I wanted to have sort of a break after my surgery rotation. So psych and neuro are usually 2 of the later rotations. So that's why I wanted to do those after surgery. Also, it happens to line up with summer, so that would be great. Have a lighter rotation during the summer, be able to relax a little. I'm hoping to do my rotations in South Jersey, so live pretty close to the beach, and then finish out with peds and OB-GYN. I ended up getting like my number 4 ranking, which I was still happy with. There was 24 possible options, and some people fell down to like 22nd or 23rd, so I'm definitely happy with ending up with my 4th favorite. The only difference between what I got and my preferred rotation schedule was where family medicine fell. So instead of doing it first, I'm doing it third. So I'm still getting internal medicine first, and then surgery, and then I'll do family medicine. It's just kind of how everything shakes out, you know. There's only so many spots. Not everyone can get their first choice, but like I said, I just wanted to get internal medicine first because while it will be hard to do for my first rotation, it's going to teach me so much and prepare me for everything else that follows. And then having surgery second isn't the worst thing in the world because I will have 8 weeks of internal medicine, and I'll still be sort of fresh and hopefully not burnt out by my second rotation. So I'm pretty confident that I'll be able to do well. I also have pretty much the same exact rotation schedule as one of my good friends here, so we'll be going through it together, which will definitely help. So after internal and surgery, I'll have family medicine, and then I think it's neuro, psych, peds, and OB-GYN. So I'll have a really nice run of family, neuro, and psych, which should be a nice break after my surgery rotation. I'll hopefully be able to work a little bit more on research projects because I'm sure that's going to be on the back burner during my internal and surgery rotations. And then I finish out with peds and OBGYN, which isn't ideal. OBGYN is a surgery heavy field and the hours can be pretty long. It's the only rotation at my school where you have to do a week of nights. And going right from OB-GYN into studying for STEP might be a little rough, but you know, there's no perfect schedule, so it'll all work out. So in the next few weeks, we have another lottery that is basically going to tell us where in the state we're doing our rotations. My school has a pretty huge health network. It's not just like linked to one specific university or whatever in one city. We kind of have hospitals all throughout the state. So the way that my school does it, we kind of get split up between North Jersey and South Jersey. So we once again submit like a lottery of our preference for that. Usually the majority of people stay up north just because we have more spots. That's where like our biggest hospital is up north. But I kind of want to go south just because I want to have a little bit of a slower pace of life, be able to live really close to the beach. I've never lived close to the beach in my life, and if I can do that for a year during medical school, I'm going to take that opportunity. You know, usually residencies are in big metropolitan areas, so I'm going to be in a city for at least 5 years, so having sort of a different experience, a different environment, I think is going to be really nice. All right, what's up everyone? It is Sunday, and I just wanted to check in, talk about how the rest of the week went. So the rest of the week school-wise really wasn't too bad. On Thursday, we just did a bunch of different cardiac imaging. So we had a 2-hour session on like thoracic imaging. We've already done a little bit of that, just like chest x-rays and CTs, but paying a lot more attention to more of like the nitty-gritty details, like how you can see the different coronary arteries with a CT. Also just talking about the different imaging techniques and why you would use a CT with contrast versus without contrast. And then we had another lecture on echocardiograms, angiograms, so even more like granular and detailed imaging modalities. An echocardiogram is basically just a ultrasound of the heart, lets you look inside, see any structural or functional abnormalities. It's usually how a lot of valvular disorders are diagnosed, like aortic stenosis, mitral regurgitation. And then angiograms are super important for coronary artery disease, seeing if any of your coronary arteries are blocked. Basically, you have an image of the heart and you inject a dye into the coronary artery. So the dye is supposed to fill up the artery in a very dark color so you can see the whole thing. It's very quick, but basically you're looking for any obstruction. If one part of the artery fills up, the other completely cuts off just very abruptly, you know that there's an occlusion somewhere. You can also just see if there's a general narrowing of one of the arteries. It's a way a cardiologist can see if they need to do any sort of intervention to prevent a heart attack in a patient. So that was Thursday, and then Friday we wrapped up with a pretty intense lecture. It was talking about a bunch of different types of carditises, endocarditis, myocarditis, pericarditis, and then also different cardiomyopathies. So a pretty interesting end to the week. What's up everyone? So I am sitting here editing this video, taking a break from studying, and I realized that I just forgot to talk about the research day that we had. It was the Friday of the week of this video, and so basically how it worked was right after class we had a medical student research day, so any of the medical students could submit an abstract, be accepted to do a poster presentation. 2 of the students were actually selected to do like a 10-minute podium. I was not selected for that. None of the M1s that I know were selected for that. The 2 things were very, very impressive studies, definitely beyond the scope of the stuff that I've done. Yeah, so there's 2 podium presentations by students. There's also a keynote speaker, and then there were 3 sessions of poster presentations in one of our learning studios. So there's just a bunch of TVs set up. I think there was like 27 students per round. Like I said, 3 rounds, and there are 30 minutes each. So basically you just set up your laptop with your poster and you stood there, people walked around. A lot of students, a lot of faculty, and basically you just explained your research when people walked up. So my project was on psychological factors of return to sport after shoulder surgery called a ladder J. So yeah, all in all, it was really cool. It was nice to see what other students here are doing. There was a lot of M1s there. I think there was like 18 M1s that had posters, which is great to see. I mean, by now we have been here for almost a year, but just seeing that people got involved in research very early on is awesome. And then seeing stuff that the upperclassmen have done is just really great. So unfortunately during my session, I didn't really have time to go around and see other people's stuff, but in the 2 sessions after me, I did walk around just to talk to people, see what everyone was up to. It was a really great experience for us, especially as M1s. You know, most of us had never really been to a research conference, so the fact that the school puts this on as a way to give us practice before going to like a big real conference is, I think, really invaluable. You know, had some pretty high-level faculty come and ask me questions. Our Dean of Research came and asked me a few questions, so overall, really good experience, and I think it'll prepare me well for real conferences in the future. And yesterday, Saturday, Mackenzie and I went into the city. One of my favorite artists, Quinn92, just started his new tour this week, so it was probably in like January or February when it was announced. I was like, wow, he's coming to New York. I'm very close. I really want to see him. That was a really great experience. Basically woke up Saturday, just studied as much as we could, and then we head into the city, went to dinner pretty close to the place, and then went to the concert, which was incredible. It was actually his birthday too, which I had no idea, so they brought out a cake for him. So yeah, all in all, amazing concert, great way to unwind. but now it is definitely exam mode. We only have one more week of cardiology and then our exam. So, and also we don't have any like extra time to study for it. Usually for our exams, we have like the week of the exam off to just study, but you know, we have class on Friday, we just have the weekend, and then our exam is on Monday. And then we start right back up the next day on Tuesday. So it's definitely going to be an intense week. The one good thing about this exam is there's technically no way to fail it, because while yes, it's like a cardiology block and a cardiology exam, it's part of a larger class that's just called hemostasis and allostasis. So we have a midterm and a final, and they just add up those scores for your overall grade in the class. So while you can't technically fail this exam, you can really set yourself up for failure for the next exam. So definitely want to do as well as we can, so we have a little bit of breathing room for the second exam of the course. Well, that's going to do it for today's video. If you enjoyed, please be sure to leave a like below and subscribe if you want to see videos like this in the future. Thanks, and I will see you in the next one.